from SigNeuro to talk about their new company, and I met with them yesterday. They joined I-10 yesterday, and we had like a 2-hour conversation about all the exciting things that they have going on, and so they're here to talk about that, and I'll let them take it away.
Hi, thanks. Thank you, Melissa. Yeah, Melissa and I had a great conversation with Ahad, my partner here, and I'll echo her recommendation for the SB-TDC office hours. They're really terrific. This is us. This is SigNeuro. When you do one of these presentations, they ask you to answer 3 questions, and we thought we'd make it very easy for you by front-loading what the questions are and asking a favor of you to pay close attention, because we'll need some help from you when we are through answering our questions. The questions are: 1, what is your company and what problem are you solving? 2, why is this important? And 3, where are you with your progress? So, question 1, we're doing something that I think all of us want, which is gaining insight, and doing something that I think very few people can, which is treating the brain. Right now, there is a traditional model for this, which you might be familiar with. It started with a great intellectual named Sigmund Freud, who founded the school of psychoanalysis. And so his idea, as far as getting insight in treating the human brain, was to talk to someone to discover the contents of their brain. And to be a little bit more specific, even then, knew that in order to do this, you had to get a little bit deeper. You had to access some information that maybe wasn't readily available. And he thought he could do this through the subconscious, right? So he'd ask you about your dreams. This model has lived on. We've not only had the model for gaining insight, but also this model for treatment. You might be diagnosed with something. They might provide medicine. They might say, come back and let's talk about your mother some more. Or if this field gets really desperate, they start doing things like shocking people or cutting out parts of their brain, all because they're trying to contend with psychiatric problems. There are a lot of psychiatric problems. What we have here is a list of things that we typically would label someone as presenting with a psychiatric problem. Generalized anxiety, post-traumatic stress disorder, social anxiety disorder, substance abuse, schizophrenia, attention deficit disorder, bulimia, or depression. But if that wasn't hard enough to treat this with the old model, even with advances beyond Freud, beyond psychoanalysis, and beyond early pharma, there is another component going on, which is there's neurological components in each of these things, and there's neurological components that are influencing psychiatric components and psychiatric factors that are influencing neurological components. So we're proposing that there should be a new model for gaining insight and treating the human brain. And this is the model which our company is founded on. We call it the precision model. It's based off of the idea of precision medicine, which is getting away from one-size-fits-all medicine. The concept was launched by the Obama White House in 2015. It's an all-governments effort, and most of the funding is coming from the NIH. The idea about one-size-fits-all medicine is pretty common if you think about it. We're already doing it in many ways. For example, the gentleman in the front has probably a different glasses prescription than I do, and that's a precision treatment for the fact that, you know, I can't see very far away, and he may have whatever vision difficulty he has. The idea is this can be applied in many other ways, and we've got this model that applies it to gaining insight and understanding of the human brain. So our model looks like this. Instead of uploading the subconscious stories of someone's brain, we can actually upload the contents of their brain, their neural networks, something called functional data. And using a machine, using some algorithms, we can actually decode what's going on and look at the psychiatric and neurological factors and derive a precise treatment. And we can deliver this treatment using brain stimulation, basically targeting the right neural network and increasing the blood flow there. And this model is iterative, much like the old model, which is let's check out the problem, let's deliver a solution that's tailored exactly to the problem, let's check out how far we got, and then let's go from there. The thing is this is, we think, pretty important, especially if it works, and that's the big question. Treatment outcomes are at stake here. The treatment can make someone better, which is the aim of medicine. A lot of people don't respond to treatment, and unfortunately sometimes treatments make people a lot worse off than they otherwise would have been. When we look at depression, just for example, 50% of depression cases, we actually don't see them seek any kind of treatment at all, and it may be because they have some kind of intuition about these outcomes. And let's just look at it. I mean, it's a happy face, it's a disaffected face, it's a sad face. I mean, it's life. It's a little bit philosophical, but this is sort of the point of the company. We're dealing with something that affects us all. But we're not just a philosophical-minded group. Sometimes data is pretty important. So we're isolating just depression to illustrate a quick example using data. At any one time, 9% of the population is depressed. World Health Organization says it could probably and likely is even more. So that means some 28 million people are suffering from depression in any given year in the United States. And like I said, half of those people aren't even seeking treatment. The ones who are entering a market that's pretty big because there's a lot of depressed people. It's a $2.4 billion pharma market now. It's got, unfortunately, a very healthy CAGR and looks to grow tremendously into the future. And so beyond philosophy and data, we think we can really drive something home if we give you something concrete. An example, I'd like you to meet Billy. Billy is an anonymized patient of ours. Billy played professional football, and if you are familiar with the sport, you know that football players hit their head a lot. Billy is a good football player, he's a lineman, and he played for a little over a decade. And he had some issues with his brain. It was changed by his football career. And from these changes, he actually had traumatic brain injuries and depression. And one thing, looking at the neurological factors and looking at the psychiatric factors, we realized is that his depression was actually caused by his traumatic brain injury, which is a minor discovery in its own right. Here's the thing. Billy couldn't be treated by the old model. Billy was treatment resistant to the old model, and any kind of intervention wasn't working on him. And so we applied the new precision model, which leads us to question number 3. Where are you with your progress so far? And the answer is we're making headway.
Yeah, it was a bad pun.
Yeah, it was a very bad pun. Thank you, John. The precision model was really successful in treating Billy, and Billy wasn't even the most complex case among the 8 people who have been treated using this model that we described. 7 of the 8 got better, and I'll leave you to judge whether or not that's significant. I can't really say. The old model in all of these cases was not effective in treating conditions where there are psychiatric and neurological factors. And we think this is important, and this is why we exist as a company. So, 3 questions, and I said if you paid attention, you could participate with us at the end. It is now that time. What I want to open up the conversation with is your own perception, to do a little bit of discovery about what you think. Would you choose the precision model of treatment? Would you recommend it to a loved one? Comments are fine too.
My first answer to your question would be like, what are the costs? Like, if someone is financially struggling and part of their cause for depression is financial hardship, what is the cost?
Right, that's a good question. So healthcare costs are sort of a popular topic these days, and I don't know that there's any one person that can speak with authority on the entire topic, but for the purposes of this discovery, let's say the costs were equivalent and assumed for insurance coverage.
So like then your next, like your most important step is then having obviously FDA approval to be able to have insurance coverage. My question then following is like, what are the demographics of depression? Like, not everybody with depression is like Billy, who had 10 years of an NFL paycheck. Where exactly are you looking to start overhauling the depression market in terms of the demographics of it?
Right, good point. So it's not just the depression market. It would be any market with neurological or psychiatric factors. But take the depression market, for example. It's actually one market that pharma has a really good handle on. Modern antidepressants work really well. A lot of patients respond. And somewhere between 15 and 30% of patients are non-responders or treatment resistant using this model. So it's still a significant portion of the population, and we don't know really the full picture because so many people, at least half by many counts, aren't seeking any kind of treatment at all for depression.
I would recommend it, but then my big question would be, what are the side effects? Sorry. My question was, or my comment was, I would recommend it, and what are the side effects?
Yeah, so the technology that we use is FDA approved, and it is safe and efficacious. The worst side effect we've had reported is a headache.
So you'll have to forgive me, I'm new. So if you're talking about this technology for this using this precision model. What sort of technology is this?
Yeah, so we use advanced neuroimaging, which already exists. And what we're able to do is, with some proprietary steps, make this imaging really useful in developing a tailored treatment plan using brain stimulation, which again already exists.
It's like a functional MRI. Sorry, is this like a functional MRI or something?
Yeah, we're using functional MRI.
Oh, okay, okay.
Good. I guess that was along the lines of my question. Is it similar to ECT? Are you doing any electric shock? Because I guess I would want to know more about the side effects. I've seen people after they've had ECT, and there is a period of time where they can't have stimulation, and it can take a month to 2 months to get back to their regular selves.
Yeah, so what ECT does, or electroconvulsive therapy, for those of you who don't use acronyms, what this does is it actually stimulates a very large portion of the brain. So what it's doing is it's doing the right thing for a small part of the brain, and it's doing the wrong thing for the vast majority of it. There's no way to actually be precise. There's no way to use this in a precision model. It doesn't have a place. What happens is, because ECT is such a broad blunt force treatment, it does often have positive effects, but it can also often cause a lot of unintended side effects. It's a one-size-fits-all model, and we'd say it's an older traditional model in the parlance we're using today.
Yeah, Ben, you've mentioned a precision model, and you've kind of described it conceptually, but I just want to hit on some of the questions here. I think maybe you just take a couple of minutes, if it's okay, to just kind of go into a little bit more detail about the fMRI portion of this, what the challenges are with diagnosing and treating this right now in terms of data analysis, data collection, and then how you guys come in with your algorithm, which is what you guys have, an SaaS model, to try to resolve some of those issues and bring it all together.
Sure. Thank you, Luis. The model is kind of complex, which is why we simplified it greatly. But I will take a minute or two to break down what's happening. So we haven't invented any new sort of imaging or treatment system. What we've done is allow existing imaging and treatment systems to be used in the precision model. We do this by some proprietary steps, which I won't bore you with, but basically we can take an fMRI image, process it, analyze it, and derive an effective treatment plan. And then we can use a tool that we're working on called neuronavigation, which is basically a way to aim the treatment and have a very precise effect.
Yep. Ben?
So essentially, you decided not to bore us with all the things that Louis asked about. So, I think the question is, we need some detail here. No one's going to take a treatment that they don't understand some of the particular details about. I mean, essentially you're saying you want to go and interact with someone's neurological processes, the very basis of what I think a lot of people consider their personality, their soul. And your answers are, well, we don't want to bore you with the particulars, but trust us, it will work. Now, I think there are some things that go into this, right? I mean, essentially what you're talking about is a feedback system that takes imaging data, processes it by some kind of method. There are plenty out there, and I think that a lot of the audience here is familiar with those kinds of methods that are used for image analysis, especially on large data sets. And then you're going to go back and you're going to use that information by processing it in some kind of metric that you will use that then guide your treatment. But I think it's the guidance of the treatment and exactly what you're doing to process this data that are going to be of interest here. If you want an answer to your question on whether we choose your treatment or not. Otherwise, keep it proprietary. That's cool too.
So, mic drop.
Fail. That's like slamming the microphone down, etc.
Somehow I think if I just wait, it'll keep getting better and better. No, it's a good point to raise, sort of trying to discover what the public perception of things. New things, especially things that present a paradigm shift, are often not easy or often recognized as such. The adoption of something like this old model, psychotherapy, was met with similar qualms. So it's a helpful data point to have someone saying, well, I remain skeptical despite outcomes because I can't understand the process fully. If I think this was a common viewpoint, we'd only have psychiatrists seeking mental health treatment.
Okay, so I take it the answer is you want to keep it secret and not disclose? Is that what I'm going to take from that?
I'm saying if you want to talk about it after we've got some fruit.
Can you talk a little bit about who your customers are? We know who benefits, if they're using your software to take the imaging things and run it through the software and get a better, we know who, we talked about the patient, but who's your customer? Like, who do you sell this to, or how do you go to market with it?
Yeah, sure. So we're sort of validating a business model for this, but we imagine that there are research and clinical markets for the technology and the improvements we've made to neuronavigation. The size of these markets varies. There are a lot of people who are using these technologies currently and struggling to adopt them to an individualized or precision model. So that's where we think the market is.
And I want to go back a little to the process, just because maybe I missed it, that what exactly is, we don't need case by case, but the treatments, are they basically traditional treatments, just better, more focused, applied in the right sequence, in the right time, or is there a new treatment attached to this? Or, are you doing the data analytics purely and providing that information to traditional treatments, or is there something else on top of that?
Yeah.
And I probably missed it.
No. I'm happy to clarify. We're using basically a traditional transcranial magnetic stimulation, which is a treatment that can be targeted to a precise part of the brain. All that we're doing is individualizing this treatment for people. It's never been done before.
Okay, thank you. Back behind you.
So my question really is, how is this going to be turned? It sounds like right now it's more of a research idea, and how is it going to be turned into a business with sales? What would be your steps that you need to go through to, get it to actually being where you are making money? And is your background in science? Are you guys doctors? Do you have people involved on the business side? Like, what are those, 2 or 3 steps down the line? How do you get it to sales, and who do you sell it to? I mean, do you train people? Does it all have to be you guys doing this? I mean, could a doctor go in and simply learn how to use this thing, or would it have to be? How is that going to work? How is it going to make money?
Yeah, sure. So it's sort of resegmenting an existing market, because there are clinicians who are using transcranial magnetic stimulation to treat depression. There is FDA approval for that. This treatment we're finding is more efficacious. We think that there's a wide probably need in the research setting, at least immediately. And we're a team of doctors, engineers, etc.
What would they buy from you? What are they paying you for? I guess would be my question. Are you licensing and technology to them? Are you training them to do something? What is your business? Right. How are you going to, what are they paying you for? Who's paying you?
One thing we didn't introduce in the slideshow is a business model. What we're envisioning is a SaaS platform to access our algorithms, and then a traditional usage-based structure, and selling a medical device as just an asset sale.
So it would be a specific type of, they would buy a piece of equipment from you.
Exactly.
Gotcha.
So to follow up on that, you're selling the equipment. Is it the functional MRI machine itself or the analysis part of it?
Good question. No, we don't manufacture fMRI machines. It is simply the analysis.
So that's the kind of the algorithm that's going to apply that, what's the name of the model, the precision model?
Yes.
And your target audience, I guess, if you will, are researchers and clinicians?
Yeah, that's right.
Thank you.
What does an fMRI cost, and how long does it take?
Good question. Most people are familiar with MRIs. An fMRI itself would cost whatever an imaging center or a university charges for it. How long does it take? You can collect functional data in about 15 minutes to 20 minutes longer than a traditional scan.
Comments?
So just moving, when would you see yourself as having sales, or when do you, first of all, how are you supporting yourself now? Is it a grants that you have? And then when would you be able to start selling, and what kind of price point are you looking at for that? What are the costs? How many employees do you think that you would go to on that side? I know you talked about the business plan idea, but what are you thinking along those lines?
So it's go-to-market strategy is in development right now. What's important to us is the science and the commercialization potential, and that's why we're here talking about that today, instead of Canvas or something.
So it seems like you have like a kidney dialysis model for your treatment plan. People have to go somewhere and have a machine work on them for a certain period of time. And so my follow-up question is then, like, people need to go to kidney dialysis, whereas we see in the current demographics, 9% of, like, there's a percentage of people with depression who don't go to it. What factors do you think will bring the people with depression who don't get current treatment in to start getting treatment? Because that's an untapped profit share that none of the other, like the big pharma, isn't getting. Do you think that you can bring in these unusing customers?
Yeah, that's a good point. I think the one-word answer suffices, which is efficacy. If something works and it works repeatedly, then people adopt its usage. I think there are some flaws with the traditional model. It's a great discovery, and paradigm shifts happen, and we think this could be one too.
So could you just briefly kind of tell me how, because I'm the patient, how this benefits my doctor or clinician in helping me. Can you summarize that in a big statement that really reflects what you're doing?
Sure. Let's look at the medical model. Doctors exist to diagnose and treat patients. If they have additional tools to do this, it's usually very helpful. As far as a patient, if a patient is presenting with a problem, we'd like to treat the problem and get better, and that happens over the course of treatment, then the doctor's been successful and the model lives on. Yeah.
So having a background in health promotion and being in the healthcare field currently, do you think this is something that can be used for, I mean, you're mentioning that it is used in treating current conditions, but do you think it has a role in preventative medicine?
That's an interesting question. Very speculatively, yes. There are some people experimenting with nootropic benefits from this kind of stimulation. It's usually very highly secretive. DARPA's working on something, and some other military-related organizations are working on preventative and/or nootropic use of this technology.
It sounds to me more like you have a product. Is this going to be turning into a larger business that then makes lots of medical devices? Is it going to just do this one thing? And how is, have you thought about selling this to a larger business to get it out there? Or what is the vision for your company beyond this product? Or is it just this, is this the first of many, or is this just what it's going to be doing?
Yeah, good question. So precision medicine is a big field. Neuroimaging is just one way to get individualized data about someone and then use it for treatment. We see our place specifically within the neuroimaging field. We know we've been talking a lot about depression, but there are a lot of people presenting with problems or that have factors, psychiatric and neurological factors. This is a big segment of people seeking healthcare. So yeah, we're not looking to be the precision medicine company, but the precision medicine company in this space.
Okay, well, I think we've got at least a roundabout way to answering some of your questions and questions of the group. Is there anything else that you want to add? And just to give you one more opportunity to say, what can the community do for you? These are always our final questions. So is there anything else that you didn't cover that you could use help with or input about? Or
It's a good question, Melissa. The second question that we sort of did start talking about is, what would validate the need to place this in the hands of people who use this with patients, which is, I guess, what I'd like to hear from the community.
Is there any other thoughts people have on that you didn't get a chance to bring up? Okay. All right. Well, we will get more coffee and do more chatting one-on-one, and I'm sure make some more connections. But thank you so much, Ben and Ahad, for being here this morning and sharing. And come back next week and bring a friend and